afternoon, everybody. Apologies for being a minute or two late. I hope everybody's well. So I'll make a start. So as always, please use this as an opportunity. Use the chat box. Pop your hand up if you've got any questions. Please interrupt if you've got a question around something that I'm saying. Please feel free. Chloe, I can see, is on the call, so I'm sure, Chloe, if you don't mind just helping, just keep an eye out in the chat box, etc. So
yeah, of course.
Brilliant, thank you. So a few bits from me, really, just from an update perspective. I think at the previous question time, I updated, unfortunately, around the increase in COVID prevalence, both in the community and in hospitals. Pleased to say that's now starting to decline. Again, still high prevalence, but certainly, as I say, on the positive decline. From a Robert Jones perspective, still dealing with a few outbreaks, and thank you to everybody for your patience with changes in mask wearing. Whereas we had stepped it down, we've now reintroduced it into clinical areas. We've always said with COVID around, you know, the only way through this is being able to be agile and change when we need it. It can be confusing. I totally understand that, but it was the right thing, certainly the right thing to do. So we keep a very close eye on all our measures, precautions, etc., and are very quick to take any action if that's required. So as I say, thanks to everybody, and please do keep an eye out on the comms that are issued fairly regularly, just to make sure that you're keeping an eye on any changes. The one change that we announced yesterday, which again brings us in line with the national guidance, was removal of what we had and had got really used to working well, the green, amber and red pathways. And you'll have seen in yesterday's comms, we've now introduced what they call respiratory and non-respiratory pathways. So again, I think the detail was within the comms, but just so that people are clear. So the respiratory are those for patients who have tested positive for COVID or any other respiratory illness or have symptoms. The non-respiratory, of course, as you'd expect, no respiratory symptoms. But I think the changes are, so we don't just concentrate on COVID. There are other respiratory infections such as flu, which some organisations, some trusts across the country have seen flu outbreaks or patients admitted into hospital with severe cases of flu. So these pathways make sure they're not just aligned to COVID, but other respiratory illnesses. So basically, there's no amber pathway as we had previously. But again, just to use, I thought the comms were good in providing a couple of examples. So whereby we may have emergency admissions, whether that be through the front door or through outpatients, we would put them in a side room and do all the necessary testing and screening for all what we would normally do for patients that come in as an emergency. If they were negative, they'd be on a non-respiratory pathway. So it was just a bit of an example. Posters, etc., and comms have been, medical illustration have been really helpful as always to pull some of that together. And I believe if they haven't already, they're going to be issued imminently. But also outlines the PPE requirements depending on the different pathways. The other thing as well to note from yesterday's comms, there's no changes to the current screening or testing regime. So this was just really around the pathways, the testing regimes as they currently stand. And again, I think on Percy, it's quite clearly outlined what that is. So that's from a COVID perspective. Just from a staff absence in relation to COVID, we have had some hotspots, predominantly in our clinical teams. So again, we've reintroduced our staffing report. So we're again just looking at that a bit more closer again to make sure, do we need to take any further action or make any other changes off the back of that. But certainly yesterday, I think our absence just from a COVID perspective was around 1.3, which is down. So I think last week it was around 1.5%. So that's purely COVID. That doesn't take into account our other normal sort of sickness absence. So it is looking more positive. But as I say, we will keep a close eye. So that was it from a COVID perspective. The other thing as well, I just wanted to draw people's attention to, which I'm sure there are already conversations and we've issued comms around, is in changes within our uniform policy. Wasn't going to use this session today to go through that in any detail. The one thing I did want to raise is that we're keen to hear from people, especially managers, and individuals, any questions off the back of it, so we can pull together almost a Q&A that will support managers with some of the general themes and questions that are coming out off the back of it. There's a lot of change within it. We're mindful that's going to take a little while to embed, but again, a key piece of work that's come out of the back of the MRSA outbreaks and regulatory concerns from an IPC perspective. So I know a lot of engagement and work has been done with individuals. I know theatres took quite a heavy lead as well in the revised policy. So, but again, mindful that any new change takes a little time to embed and people to fully understand what the changes are. Chloe, I might have a chat with yourself around if you could help coordinate the questions for us that come through, so we can almost pull that together to issue back out, because I bet you know, one person will have a question, other people will have a similar question. So if we can pull almost that fact sheet, Q&A sheet together that we can share more widely, I think that would help support implementation. And then the final thing from me before we start taking any questions is, and this is really exciting, and people will have seen that we've now signed the contracts with System C, our choice of suppliers for our electronic patient record. And, you know, when I came to the Trust back in November 2019, when I started, you know, this was something that was being discussed then. So great that we're now in a position that we've signed a contract, we've gone through a rigorous procurement process to identify who we want to work with to implement it. You'll start to see a lot of comms coming out ahead of the implementation sort of kickoff, which is planned for September. But mindful, you know, a digital system is an enabler. And, you know, we need the people that work with the clinical systems, etc., to really understand and see the benefits that it will bring to both clinicians, non-clinicians. It will touch everybody within the organisation. Whatever role you do, this system will have an impact. So for the positive, I hope. I really do hope. So yeah, please do get involved, attend some of the briefing sessions that are being planned, just so that you've got an idea around, you know, what the system will do for you, how it will help you in your work, but also how you can potentially as well start thinking around any concerns that you might have that we need to pick up as part of the implementation. So we've got obviously Simon Adams obviously supporting from a digital perspective. We've got Andrew Roberts, Ruth Longfellow, James Neal from a clinical perspective, Ian McLennan from a nursing perspective, and an AHP representation, as well as non-clinical as well. So, you know, this is very much a trust effort and a huge piece of change work that's going to take a while to implement and fully embed. So, oh, sorry, folks, if you're not on mute, could you go on to mute? Thank you. Brilliant. So yeah, really exciting piece of work, but please do start to engage in what we're putting out there for the trust to take part in, because I think it will help certainly come implementation stage. So they were the key things that I just wanted to cover this afternoon. But again, Chloe, is there anything so far in the chat, or if there's anybody that wants to pop their hand up, please feel free to do so.
No one's popped anything in the chat yet, Stacey. I was wondering if you wanted to quickly touch on the travel expenses increase that happened last week as well.
Brilliant, thanks, Chloe. And yes, thank you to those that have fed back. So certainly within the manager's briefing that I do, this was raised. Karen Delmans, didn't she? She raised this previously. I'm fortunate to have outpatients as one of my buddy areas, and I know, speaking to some of the staff within outpatients who do outreach clinics, that the cost of fuel was having an impact, certainly having an impact on those people that have to use their car, certainly for work travel. We've been able to negotiate and do this as part of as the system, to make sure that there's fairness and equity across, certainly across the NHS providers. So we've been able to negotiate an increase. I think it's about 10p, I think, isn't it, Chloe, a mile from a fuel cost that you can be reimbursed. We've put it for 3 months and then we'll review the situation. But at the moment there is a lot of national discussion. So I do think maybe nationally something may be done to improve the current situation. So you know, it's a little way of acknowledging how incredibly difficult it is at the moment, cost of living, etc. So I hope it's been received in the way it was intended to see where we can support. But again, always keen to see what we can do. But if people post ideas or areas of concern, then, you know, I always commit that I would take that forward and support where I can. So yeah, I'd say positive. Thanks, Chloe. Yeah, forgot about that one.
Jane Dewsbury's asked if the increase includes mileage for leased cars as well.
I presume so, but I'll take that away and just to double check. I'll come back to you separately, Jane, but I'd have thought so, because you're having to put the fuel in, aren't you? So I presume it is.
Thanks, Stacey. And that's it so far. We've got a quiet bunch on today.
I hope that's because people feel that they know what's happening through other communication channels. But yeah, anybody wants to pop their hand up, anything that's concerning, or feel that we're not communicating enough? Anything else, Chloe, I've missed? I always tend to look back just to make sure that I think the focus, you know, very much at the trust at the moment is the recovery element. So, you know, and I know there's a lot of people on this call that are involved in, you know, the backlog, certainly, you know, the focus, although on all of our waiting lists, but very much on those that have waited the longest. So, you know, really pleasing performance in June. We came in ahead of trajectory for how many patients waiting over 104 weeks. And again, the update that I've had this morning is July, although it was looking tense, is looking far more positive. So as well as focusing on those from a clinical priority perspective that need to come in from a clinical perspective, you know, it's a balancing act with those that have been waiting over 2 years to access our services. So that's going, you know, that's going incredibly well. The IPC improvement plan off the back of the outbreaks and the regulatory concerns, again making, you know, really good progress, and I'm hoping people recognise some of that around the organisation with the estates work, different processes, audits, etc. The uniform policies is part of that work. So still a lot of work to go. It's a big improvement plan to work through, but certainly making really good progress and embedding the changes that we're making along the way, which is the most important element of that. And the other thing, again, just things that are happening that very much is the focus of the organisation, is CQC preparation. And I think I've spoke previously, and again, there'll be some more further information coming out around how we can support wards, departments, etc. on their CQC preparation. So it's busy, very busy. It's hard sometimes then to think, okay, what do I need to update people on, because there's so much going on. And 2 new, certainly executive starters People I'm hoping will have met Mike Carr, our new Chief Operating Officer. So I think he's on week 3. And we had start yesterday Denise Harning, who's our interim Chief People Officer. So Sarah Shepherd, who's worked with us on and off for many, many years, who stayed with us during COVID, as she was looking to leave us pre-COVID, but stayed with us. So whilst we go out for substantive recruitment, Denise is joining us. So we've made sure that's a smooth transition handover, and I'm sure Denise will be out to meet people shortly. I could talk forever, Chloe, couldn't I?
We have had a question from Mr. Kelly.
Yeah.
So he's asking if we know if staff are continuing to lateral flow test, and are we all auditing this or keeping any record?
Yeah, good question, Cormac. So we get reports that are fed through from the national reporting system. So I would say staff are testing, because we see that in the results reporting that we do get, but it doesn't go into that much detail. I'm sure there are more staff lateral flowing that aren't reporting results, but we have an indication, and we remain fairly static, but it gives us an indication that if it starts to drop off what we're seeing, that we need to do something different. So yeah, the plea from this is please do continue, because we are still picking up, and people will know this now. You're well versed. Asymptomatic, it's still happening, and of course at the moment there's been a lot of people. I certainly have friends that thought they had hay fever, and actually on lateral flow that I encouraged them to do, a few of them were positive. So you know, time of year with hay fever, sniffles, etc., because of that. So yeah, please do continue to do your twice weekly and report it. Please do report it. Thanks, Cormac.
Thanks, Stacey. One more question has just come in about the uniform policy for medics on call. So Samuel's asking, are they to use personal scrubs, or will the trust provide scrubs for medics on call?
Yeah, can we pick that one up offline? If I can come back to you individually, and again, I think it would be a good one to put in the generic F and Q, Q&A. Yeah. We can put it in there. This is a really good question. They're the sorts of things that we want to be able to make sure is clear and well communicated across everybody. So we'll pick that one up separately if that's okay, and come back to you.
Stacey, and that's it at the moment.
Okay, I'll give it one last opportunity if people want to raise their hand. If not, we'll call it a day, but please do. Maybe not now, but any questions, jot them down. And as I say, these take place every fortnight, so be good to hear from people. Okay, brilliant. So just to close then, thank you. Thanks for everything everybody continues to do. Very busy, extremely busy, and I think it's going to continue this way, isn't it, for some time. Whilst we've got the challenges certainly that we've got, but thank you to all of you and your teams, and keep up the great work. Take care.
Thanks, Stacey.